In health news, nearly 1.3 million knee replacements and up to 760,000 hip replacements are performed on Americans each year. This is according to the University of California, Davis Health. Typically, these surgeries are invasive, but advanced technology is changing the game. Youngstown's Orthopedic Associates recently welcomed Mahoning Valley native Dr. Hunter Spitz. He's an orthopedic surgeon that specializes in adult hip and knee replacements. He's joining us here now to share more on what patients need to know. Doctor, thanks for taking the time.
Thank you so much for having me.
Yes, you specialize in using the anterior approach in hip replacements, a more minimally invasive technique. So can you describe how this differs from the other total hip replacement surgeries?
Yes, that's correct. It's a newer technique. The incision, instead of being on the side of the hip or the back of the hip, is actually on the front of the hip. With that, it's a muscle sparing technique. So we work through muscle planes instead of cutting through muscle. So with that, there's a little bit of a quicker recovery for patients and less postoperative pain because you're not cutting through any muscle like you do in some of the other approaches to the hip. Patients also have a lower risk of dislocation after hip replacement, which can be a very painful complication. There are also other benefits, including when you do an anterior approach hip replacement, a patient is actually able to lay on their back. It makes it a little bit easier sometimes on the anesthesia team to provide anesthesia, but it also lets us use X-ray during surgery. Using X-ray during surgery is critical to, more proper and accurate implant placing. We can more accurately judge your leg lengths. So there's a lot of advantages to the anterior approach to hip replacement.
And what about the recovery time? Is it shorter than the traditional?
Yes, I mean, it definitely is a little bit shorter. I think it's a lot easier too. That's a great point that you brought up. A lot of folks who come see me back in the office are on a cane or honestly no walking aids at about 3 weeks or so. But the big thing too is postoperatively with the anterior approach to the hip, because you're not cutting through muscle, you don't have as many hip precautions postoperatively, meaning you don't have a pillow in between your legs, and you don't have the funny precautions where you can't cross your legs or can't sit in deep chairs. So I think it's a lot easier on patients as well. For fracture care and for arthritis care to have an anterior approach.
And are you seeing a rise in the need for these types of surgeries? We have an aging baby boomer population. A lot of folks, worked in manufacturing in this region. What have you noticed?
Oh, certainly. I think there's definitely a rising need. I think I've seen a lot of younger patients even needing hip replacements as well. And I think that the patient education has definitely increased. A lot of patients who see me in the office have read about different approaches to the hip for hip replacement. And I think patients are becoming more and more informed, which is great. But I've definitely seen a rising need and an increase in patient education. And I think it's obviously tremendous.
Doctor, is there anything that could prevent a patient from being a suitable candidate for this type of surgery?
Yeah, that's a great question. I think that the optimization of your health is critical. Most hip replacement patients are extremely happy. It's one of the most successful orthopedic procedures. But ensuring that your cardiac history, your heart function is good. I have all my patients quit nicotine use to reduce the risk of infection. And then really, some patients have to have some dental examinations as well to make sure you can't seed your artificial hip or artificial knee joint with infection. But the biggest thing you can do is take care of your health and then make sure that you see your doctor and specialist preoperatively.
Real quick, 30 seconds left here. At what stage should someone consider the joint replacement? At what point in your injury or pain do you need to get to the doctor?
That's a great question too. I tell everybody I treat you, not the X-ray. So if you start to have pain about the hip, which is limiting what you like to do, limiting your sleep, you can always start with non-operative care too. So I think if you are having hip or knee pain, which is limiting your quality of life, I think it's time to go talk to an orthopedic surgeon or your primary care physician on some treatment options, including non-surgical and hip or knee replacement.
Yeah, we want to keep on moving and have a good time doing that. Dr. Hunter Spitz, thank you so much for taking the time to join us live here at 5.
Thank you so much for having me. Appreciate it.